Good morning, ladies and gentlemen. Welcome back to Uppsala Health Summit. And now we are about to embark on our second day of broad conversations over health and food. I hope you had a good night's sleep. I hope you had a good dinner and enjoyed some conversations with fellow delegates. So I would just like to I was inspired by the Vice Chancellor of SLU last night, and I would like to invite you to close your eyes. Feel your feet on the floor and take one deep breath. And then take another deep breath. So this was a way to bring in the biosphere into the room. We have food, we have coffee, we have drinks, we have fruits, but also to bring in the living ecosystems that provide us not just with food, but also with oxygen. So half of the oxygen we breathe is produced by the ocean, so that's one breath. And half of the oxygen we breathe is produced by the terrestrial green, so that's the other breath. Thank you. And now, to get us back on track after a nice evening and night, we will start with a review of yesterday's workshops. So I invite all the 5 workshops leaders from yesterday to come up on stage with me here. And we will hear a few minutes and conclusions from each workshop.
Please. Am I second?
Great. So we start off with food planning for sustainable consumption. Fredrik, welcome.
Yeah, thank you very much. So I will give a brief summary, and I will begin with what we didn't, where we did disagree, and that was what is food planning, because it can really be different things depending on where you are in this food system, if you are in a municipality, or if you are in the national government, or if you are just an ordinary citizen like us. We agreed upon that the food system is complex and all actors need to participate in this. And it could be that we need both bottom-up approaches and top-down approaches. There is a large range of tools for food planning, and the question is, what is then food planning? But you can imagine that we need a strategy, a goal where we want to go. We want healthier living, we want sustainable food consumption, sustainable food production. We also need a plan on how we use the land, our living environments. So there we have the spatial planning. And then we have this toolbox, what we can do. And there is a large range of tools that can be used. For example, the typical policy tools, we tax everything, or we give subsidies, or we have regulations, the typical national policies. But there are also other things that we can do in different levels, like procurement of food in public sector, or food in education, school gardens, and other things, so that we foster food literacy already from childhood. We can promote local food in different ways. We can promote so that we can produce food locally, but also facilitate marketplaces, for example, where consumers and producers can meet inside the cities. And we also need more meeting places where we can discuss these issues. Also, we have participatory processes. Everyone needs to be included in discussing the future. There could be local food councils, which we have heard examples of. Communication, knowledge sharing is very important. And also we could have production of food inside the cities, like urban horticulture and agriculture, which we hear more and more about. So there is a large range of tools. What next? We will continue this important work. But first, we want to thank everybody that participated in our workshop, of course. We will write the report, and there will be a policy brief, and then we will continue the exploration. Thank you.
Thank you, Frederick. And then we go to Mina and the SHIFT framework for health equity in food, environment, and transformation.
Good morning. So yesterday we had our workshop on the SHIFT framework, which is a tool to enable equity focus in food environment transformations. So this was a tool that we originally developed. It's a work in progress, but we've been developing it now over the past 2 years, also in collaboration with WHO and EAT. And the focus has been on enabling technical staff to actually undertake this task. So so we had very rich discussions, and I have to say we have also turned the tool around in many ways. But I think some of the most important messages that came across, for example, was the first one was about operationalizing equity. So we realized that we all had our own ideas about what equity was, and it didn't necessarily need matched with the others. So one of the most important things would be to operationalize equity for the tool, and also that the tool per se follows a systems perspective and uses 4 different steps of map, engage, transform, and monitor. But some of the steps which was considered as missing, for example, commitment was considered as should be an explicit step, both in terms of engagement of stakeholders, as well as commitment of financial resources, which is actually needed to do the work. Then the other main thing was also to clarify the focus, which was, so the tool focused on food environment transformations. So the focus on whether it is food systems, food environment, and nutrition, to actually clarify it and make it come throughout. So one of the things that we have used as a backbone is one of the frameworks that has been developed to describe food environments, called the ANH framework. And one possibility that we could actually discuss was to see whether indicators for 2 of the steps on mapping and monitoring could perhaps overlap and potentially be based on the framework on food environments. And also that the structure of the tool as such was, even though it was meant to be iterative, that is not what comes across in the tool. It looks like you actually enter at one point and exit at one point, which is not the objective. So we have to be able to make the tool more iterative, more flexible, so you can actually flow between different steps, which is really what happens when we work in the field. And also to think about, should the tool be actually pitched to technical staff or to actually communities to look at food environment transformations? Should it be a tool for communities to use in terms of how to think about food environment transformations? So, and maybe I will end with this one, which is how we have ordered the steps. So one of the things that one of the speakers pointed out was maybe identifying communities comes before actually mapping inequities. And we have, there are different ways of looking at it, but perhaps what we thought about was maybe it needs to be more of a back and forth, and it's not a linear process where you do something first and you go back. You often need to go back to the previous step to maybe refine what you have done so that the second step becomes more informed. So next steps, a lot of work to be done, but we do have a working group where we will actually discuss this, and hopefully also be able to involve some of the participants in the workshop. We've tested it out in one of the field sites, and we will do some more testing, hopefully in Australia next year, and the work will go on. Yep. So I will stop right there. Thank you.
Thank you, Mina. And then we have the sustainable animal food production in war and peace.
Right.
Welcome.
Very good. A really important topic, especially obviously what's happening in Ukraine. So that's the first thing I'd like to say. Really useful to have the opportunity to discuss these things, which I don't think have been discussed enough generally. Excellent presentations in the workshops, particularly Anne's and Serena's. I'm not sure about mine. And really enjoyable and informative exercises. So thanks to Marlin for that. And we ended up at the end of the whole thing with hundreds of post-it stickers stuck all over a screen about the same size as this. And I wished afterwards, while I was thinking about what I was going to say this morning, that I had just taken a picture of that, because then I could have just shown that picture instead of the slide, which has got far too many words on it, which is coming next, I hope. Do we have the next slide?
Yes.
Okay, so what did we agree upon? Well, I'm not sure that we agreed on any of these things I've got up here. These are my personal reflections on the workshop. So I apologize to any other colleagues from the workshop if you disagree with any of this. You can take it up with me afterwards. Preparedness. Clearly it varies in different contexts, and it seems, just from the conversation, that Sweden is thinking much more about this than Denmark. And it also depends on people's personal perspectives. It seems that people in government agencies in Sweden are thinking much more about this than others. It appears Arla is not thinking about this as much as it probably ought to. But clearly we need to do more, much, much more. Making change happen, there's no one-size-fits-all approach. It needs a mixture of voluntary legislation, carrots, communication, education, flexibility and planning in order to try and prepare for war. And farmers are really smart, but there's a real risk of the tragedy of the commons or the prisoner's dilemma if there's not some kind of legislative framework to shape things. And a bit of a conversation about, is war different to other natural disasters? Challenges and responses, inputs, well, all the usual things, fuel, electricity, fertilizer, seeds, but also water. Water could be a real constraint. And if there's a call-up, loss of labor, loss of expertise in the rural areas. In terms of food security, there was a conversation that the current emphasis on maximum production is probably the wrong approach. We need new, more hardy, well, old, more hardy breeds, low production, and super specialization makes it very difficult for farmers to change the way they do things. Animal health, low capacity for slaughter, diagnostic facilities, preservation of meat, maybe you need to revert to old measures, salting meat, but do people have enough salt? Logistics, obvious things like lack of fuel, but if the internet goes down, everything goes down. And other things, well, conversation about we really need to change the overall rules of the game, the way in which things happen. You need to get the right incentives in place. We need to promote local and interlocal collaboration. And then a bit of a discussion at the end about some of our own prejudices. There's a kind of feeling that big is bad and small is good. That's not necessarily the case. Larger units may have much better access to resources, better able to close the sustainability loop. And also, technology is not necessarily a bad thing. For example, small-scale solar might be really important. Next steps, I'm not sure. Ask Sigrid and Ulva.
Thank you. And then Caroline for the Diet Environment Health Nexus.
Yes, good morning. I'm stepping in for Alicia, who is theoretically the workshop leader. So I'm not taking her prestige in that sense. I'm just co-organizer, and I'm very happy to be able to summarize here the results of the workshop D, the Diet Environment Health Nexus. I didn't prepare a slide, there was some miscommunication, or my fault. But so the aim of our workshop, or the topic, was the connection between food, health, and environmental issues. And we were interested in discussing and finding solutions how to generate behavior change among individuals and in society in general. And I think we had many discussions surrounding what kind of tools are the most appropriate and effective ones, moving a little bit between more tight interventions like laws and taxes, bans, like policy interventions, and then also, on the other hand, discussing more the need for more collaboration between industry, policy actors, and different other societal actors. I think 3 things that we agreed on, which I have in my notes, is that we all agreed on that there is more active engagement with, or also in, policy and politics and society needed by ourselves as researchers, and also we have to contribute to advanced communication about nutrition and environmental issues, and also the connection between nutrition and environmental issues at a broader variety of venues of society, like at schools, at nurseries, at sports associations, medical practitioners, etc., so that people in general get more knowledgeable about what is actually healthy food, and why can healthy food also be environmentally friendly. And then we also agreed on the need for more collaboration between the different actors, like policymakers, industry, and also citizens and civil society, and also the need for more actively involve industry in both research, but also especially together with policymakers, to take them on board and not only regulate them. Then some things that we disagreed on was the need for policy interventions, because we were also not sure to how and to what extent is the best way to do, also accounting for side effects and possible backlashes or even ineffectiveness. We also had actually the discussion, or a brief reflection, of whether policy does anything at all, so whether it can actually be an effective tool, and whether it's actually what we need. And we also we had the point that, did we actually get to some concrete solutions, or is it again just a workshop leading to some fluffy discussions and intentions? So yeah, I don't know. I think that was something we possibly disagreed on. And then where to go next, the next steps. We said that we need more joint and consistent collaboration between public actors and industry, as mentioned. We also need to ourselves, as researchers, get more actively involved, both in our individual roles at home and in our everyday lives, then also in our public role, and in especially the role as researchers, or whatever your role is in society, and your employers, and more spread the knowledge and and enthusiasm maybe also about healthy and environmentally friendly eating. And then we also all agreed on that we need to work now on spreading more awareness and actionable knowledge about the fact that healthy and environmentally friendly food are actually connected, and that this is something attractive, or where we have to head on to. Yeah, I think that was it. Thank you also to all the participants for very nice discussions yesterday.
Thank you. And then last but not least, Johanna, and Zero Hunger is mixed smallholder farming the solution that was held also digitally.
Yes, can we get that one back? It was shown before.
Yes.
So it was already mentioned that small may not always be good, but here we had are we having the right slide? Yes. We had a whole workshop on actually the smallholder farming as a contribution towards the Zero Hunger goal. And I might there start with a disagreement, which was more of a misconception that smallholders are always poor and vulnerable, and that is not always true. It depends very much on which context, where you come from, and the smallholder farming is actually a very diverse type of farming. But what we agreed upon is that there is an important to better understand well, how smallholder farmers can adapt to new technologies and how this can be promoted and what are the incentives. That women empowerment is not only about including women, but also make sure that we have equal benefits between the genders. And that it's important to actually focus on different agroecological practices that are important to enhance relationship between smallholder farmers and consumers so that you can actually have an improved food system. And that in some contexts at least, it's important to promote cooperatives and other systems where smallholder farmers are not working completely alone, because alone can really be vulnerable. And we agreed on one next step, which is to write a policy brief as a concrete outcome of this workshop. And with that, I will hand over, because we're over time. Thank you.
Thank you. And then, before you all step down, I'd like you to come up a little bit closer to me. And I think you and all workshop preparational responsible people take also this to your heart. So thank you for all the work you've been putting into the workshops. Great. Thank you very much.
Thank you.
And now I have the very unusual task as a moderator that we have time, like too much time, because that's unusually not. So also kudos to you for keeping the time extremely well. Because the thing is, we've posted that we will start the online screening at 9:30, which is in 5 minutes. So I will give you 5 minutes to have a chat to your neighbor about what was the most interesting thing you brought with you from yesterday. Great, thank you. So now we welcome our online participants as well. We hope you had a nice, refreshing evening and night since we saw you last. We will now dive into our third plenary session, and I am delighted to welcome our first speaker, Professor Corinna, who is from the Center for Food Policy, University of London, and she will talk about how to drive systems change. And this third session, while you come up, welcome Corinna, has the title Transformations on the Ground, Policy Participation. And we will look into the toolbox of policy interventions to create the right incentives for adopting more appropriate practices aimed at system change. Welcome. And you have the clicker there.
Thank you very much. Thank you very much for that introduction. It's amazing to be talking in such a fantastic room. Great to be here. Thank you. To talk about these important issues. And I'm very grateful for the Uppsala Health Summit for taking on this issue of food systems, which is so important. And what I want to talk about today is how to do things a bit differently. It's clear from what we've heard that we need to do things differently. And I'm going to present 5 approaches, 5 toolboxes, if you like, of how we can do things differently, 5 different ways of thinking about doing things differently in policy and participation as a particular focus. And to do that, I'd like to tell a story. I'd like to tell the story of the food system. The food system had one main aim in life. The aim of the food system was to produce as much food as cheaply as possible, as competitively as possible, and make money for the people who controlled that food system. As the food system liked to say, calories and cash. The food system was tremendously proud of this. Think of all of that food flying around the world. Products like wheat and soybeans and corn could be produced in the places where it could be produced most efficiently and then exported elsewhere so they could buy foods more cheaply. This was fantastic for economic growth for those countries. It was fantastic for the companies involved. It produced byproducts for lots and lots of animals to eat, lots and lots of them. It produced ingredients that manufacturers could use to create all kinds of fancy ultra-processed foods that people seem to love. Yes, the food system was very proud indeed. But then something started to happen. The food system started to feel unwell. The muscles of the food system started to weaken. The amount of energy the poor food system had started to decline. The resources that it had to make sure that enough food could be produced started to dwindle. And the weather started to do all of these crazy things that made it more difficult to produce food. The food system became sick. So the food system went to the doctor. It was quite an unusual doctor. And said to the doctor, "What's wrong?" And the doctor said, "You're exhausted. You need to take a few years off to regenerate yourself. Otherwise, it's only going to get worse." And the food system said, "But I can't do that. I need to feed people. If I don't produce food, even more people will go hungry. People will die. I can't afford to take time off to regenerate." And then the food system said to the doctor, "And besides, I'm proud of what I do. I work hard. What I do means that people don't go hungry. And what I do means that people are really healthy. I'm so proud that I stopped the world going hungry, and I helped the world be healthy by producing all of that calories and all of that cash. And the doctor looked hard at the food system and said, look, I'm sorry to break this to you, but you've been working really hard to produce food, and it's actually been making people sick. In fact, most of the people that I see in my clinic and in my office are people who've been made sick because of food. I see kids who are wasted because they're not having enough food. I see kids who are stunted because they're not having enough nutritious foods. I see people who are ill because of foodborne disease. I see people who are affected by overweight and obesity and are suffering from cancers, from heart disease, from hypertension because of the food that they eat. And that's most of the people that I see. The food system was shocked. The food system hadn't realized this. And as you can see from the center of this figure here, the food system was sad and started to cry. So the food system, who was a good old soul, said, I've got to do something about this. What am I wearing myself out for? I'm not resilient, I'm not sustainable, and I'm making people sick. What's the point? Why bother wearing myself out when I'm not even helping people be healthy? So the food system said to the doctor, who was wise, what should I do? And the doctor said, well, first of all, remember that the reason that you have become sick is because you fail to see yourself as a whole body, as a holistic body. You fail to see that the resources that you have are connected to the health of people. You fail to see that what is produced affects what is consumed. You fail to link environment and health and economy. You didn't think about all of these different parts of your body in a holistic way and together. So I advise you to think more holistically about the approach that you are taking. And the second piece of advice I have is that there are lots of people out there who can help you. There are lots of people out there who are trying to make change. There are lots of people in all parts of you who can help you. Go and gather them all together and work together for change. So the first toolbox is a food systems approach to decision making that puts the food system at the center and recognizes the food system as a system and recognizes that there are particular problems that need to be addressed and how to engage the whole of you, the whole of the system behind that, while managing all of these different aspects of your body to move together in forward motion. And in so doing that, it's vital to include everybody. It's vital that everybody participates in this process and that everybody with a stake is involved. But those people will have different interests. They will have different incentives and they will have different solutions. So there's going to be conflict. There's going to be disagreement. There's going to be people pulling at your body in all kinds of different directions. And you need to acknowledge that in that discussion, people have different levels of power. And that's part of the reason that you're facing the problems that you face. So that needs to be acknowledged and manage those power relations and conflict in part of that space of shared decision making. So the food system went off and started to do this. And the food system found that people came up with shared agendas. They found shared objectives. They found ways of working together. There was a lot of conflict, but there was a process of managing that all the way through. And the food system also found that they found particular actions that they could take where connections between these parts of the system were created, where co-benefits were found, where synergies were found, all the way from production to consumption. And you can see just a very small example of the tremendous amount of actions that were being taken and are being taken in order to make those connections for co-benefits and synergies, to align that food system towards health. Policies and actions that explicitly are designed to bring the different parts of the system together. Now, after this had been happening for a while, the food system felt a lot better and went back to the doctor. And the doctor examined the food system and said, you know what, you're really getting a lot better in lots of different parts, but it's a bit isolated. It's here and it's there, and it's good here, it's not so good there. It's kind of like you're beginning to regenerate in different parts, but it's not quite the whole yet. And the food system said, well, maybe I need to wait a little longer. And the doctor said, well, how's your heart? How's your heart? And the food system said, well, you examine it. And the doctor examined the heart and said, no, there's something not quite right at the heart of your system yet. What do you think is really driving this problem? What is really at the core of the problem? So the food system thought and said, what really is the problem? Why are we still coming up against barriers? Why is it that people are still saying, well, I'm doing this, but there's all of these things that are trying to stop me and getting in the way? So the food system decided to go and talk to the people who were really in control of the food system. The big banks, the big corporations, the major governments of the world. And the food system realized that they had been benefiting all along from the way that the food system had been operating. They had been economically benefiting, and the costs had been borne elsewhere for the food system being exhausted and worn out, and for health. And so the food system said to these big, powerful actors, look, why are you putting all of these incentives and policies into place that are making me behave in a certain way? And these big, powerful actors said, well, we're stuck too. Modern forms of capitalism aren't working for us either. So how can we make changes to unlock the core of the problem, which is that the incentives are all around moving in the direction of creating economic benefits for certain actors and creating profound inequalities rather than the solutions that we need? So the food system said, well, is this something we can do? And they said, yes, there's plenty we can do. So they started to put some of these actions to work. You can see some of these actions that can be taken to start to change and reorient the wheels of the food system economy: financing, competition law, corporate governance, investor metrics, food environment regulations to level the playing field. There was plenty that could be put into place to start to steer the food system's economy and completely re-incentivize the way that the economy worked, because that was at the heart of the problem. So the food system really began to see some change, because this unlocked the possibilities of all other kinds of changes that could then happen in the food system. But the food system realized there was also somebody that the food system hadn't yet spoken to a lot of people, involved a lot of people out there. And that was the people who eat. Because the food system realized that you can make changes in the economy, you can make changes in all kinds of different ways, but unless you involve the people who actually eat and understand their lived experience of food and why it is that they eat what they do and all of the many factors that shape what they eat, you weren't going to be able to change their ability to eat healthily and sustainably. So the food system started to speak to the people who eat all over the world and discover there were all kinds of reasons and all kinds of possibilities and opportunities to change things in order to help them eat more healthily and sustainable. There were actions that you could take to make people more financially secure. There were actions that you could take to reduce the relentless nature of food work. There were actions that you can take to improve household and transportation infrastructure so people could prepare and eat food at home and cook. There were issues around social norms and networks, around gender, which were preventing healthy and sustainable diets. There were issues around access. There were issues around the enticements in the food environments that were diverting people in the wrong direction. There were issues of trust. There were issues around things like racism and marginalized communities. And the food system started to have this, to say, why aren't you trusting why aren't you having trust in the messengers of this healthy and sustainable diets message? Where is the trust breaking down, and how can we build it? How can we create meaning through food? How can we make sure that healthy, sustainable food has meaning in your life, has status, has value, that people believe in it? And how can we make sure that you like it? And wow, there were so many different actions that can be taken to make this happen. And people rolled up their sleeves. They understood their role, they took their responsibility, and they made all of these changes. And the food system really began to get a lot better. And went back to the doctor and said to the doctor, I'm almost better. The doctor was shocked, because the doctor happened to know that we'd been trying to take all of these actions for years. People went to summits. They went to conferences. They did research. They said all kinds of good things, but things didn't really happen. So the doctor said, what was the magic ingredient? What really made this change happen? Meant that people really started to act and take their roles and act their responsibilities and do things for collective impact. And the food system thought for a moment and said, well, I did happen to notice there was lots of women in charge. The food system said, I also noticed that lots of other marginalized groups and minoritized groups were in charge. They were making decisions. And what was really interesting was that the way that were they and all of the others that were involved were making decisions in particular ways. They prioritized social purpose over things that matter less to people. They were utterly committed to what they were doing. They persisted in their commitments, but they made mistakes. But they learned from those mistakes. They were happy to talk and be open about those mistakes, and they adapted from them. They were happy to stand up and be courageous in deviating from the norm with ambition. They didn't spend time pushing themselves forward. They were about lifting others up, particularly those who were marginalized, but listening to the unheard voices and listening with curiosity to the people that they disagreed with. They reflected individually and collectively on what they could do, and they connected with those who they really felt they could work with for collective action. And in so doing, they communicated with each other openly and authentically. In other words, said the food system, leadership. That was the magic ingredient, leadership. Thank you very much.
Wow, thank you. Amazing. We will get Corinna back on stage together with the other two speakers. And so now I'm happy to introduce to you Dr. Meena Davaidan, that you just met. But for those who read the program properly, we have a change in program. So T Höglund was unfortunately ill. She has a cold, she's fine. But we are super happy that Meena spent most of last night preparing to give her some more reflections from her work, and under the title Operationalizing, Leaving No One Behind. So, welcome.
Thank you. A very good morning. And as Louise was saying, I'm the backup speaker, so cut me some slack. And I'm also going to use this opportunity to put across some reflections that I've had along my journey so that you can actually do the same and maybe add to that list. So, I was thinking about what to actually talk about that would put the theme of the summit into perspective as well as the theme of this particular session. And I thought, okay, we are actually in towards the end of the SDG era. We're coming to the close of the Agenda 2030. And we have been talking about leaving no one behind. But when we actually talk about it, what do we really mean? And what are some of my reflections on maybe the challenges and some of the considerations to think about in actually operationalizing this from the perspective of food environment transformations. So, and I have to say, I actually will come back, Corinna, to your presentation and maybe put a little more burden on the poor food system, because I will again go back to one specific part of the food system, but I also hope that we will also talk about some things which actually contribute to the heart health of the food systems, right? So I will actually start by situating my work so you can actually understand where I come from. So I work mainly with intervention and implementation research for non-communicable diseases, especially prevention. So that is really my entry point into food environment and food environment studies or food environment research. So it's really this part of the food systems. It's a very key node in the food systems, and I recognize that we are further maybe fragmenting or focusing on one part of the food systems, but it is a key node where actually it is the interface that mediates people's acquisition and consumption within the wider food system. So it is a really key node in terms of interaction. So this interaction between the personal food environments and the external food environments, that's really the space that I focus on in my work. And also in terms of, during this presentation, I will refer to some of my work, so mostly implementation research projects, which are represented by that small red square that you see along the efficacy to implementation pipeline. And this square represents the bulk of my research focus in terms of, and a lot of the examples that I actually present will be based on my work both in Sweden and in India, as well as a few other countries. And also, during this presentation, I'll reflect a little bit about the other work that we have done, which is maybe the furthest I have come in terms of the work with intervention and implementation, which is to really look at, which is to actually look on the shift framework, which you actually heard in the workshop highlights. So we actually, this was a tool that was developed to actively enable an equity focus throughout the food environment transformation process. And it actually consists of 3 parts. So it has a 4-step process, it has a compendium of good practices, and it has resources. And as I've said in the highlights, this is a work in progress, and based on the feedback from the workshop, there will be some reflections here, but also a lot of work that needs to be actually done in order to align it with a lot of the things that you have heard both today and yesterday. So I think one of the first things that I alluded to in the morning is about operationalizing the concept. So for me, leaving no one behind is in a way thinking about equity, but it is also maybe only one part of equity, because there are a lot of other considerations for equity as well when you think about the concept, when you think about operationalizing the concept. So from our discussions yesterday, and also from some of the other discussions we've had in relation to the research projects that we run, is it that we are actually looking at addressing differential needs, capabilities, opportunities, and resources? Are we looking at reducing gaps maybe between groups? Or do we have a universal goal that we are actually trying to reduce gaps of all the different population groups against a universal goal? So what is how is it that we are actually operationalizing this particular concept. And in my work, I have mainly done that by looking at geographically defined communities. So even when we have worked with individuals and households, we have worked with geographically defined communities. So maybe under-resourced areas in Uganda could be rural areas where the bulk of the resources go actually to urban health systems and not to rural health systems. It could be urban townships in South Africa, and it could be socioeconomically disadvantaged areas in Stockholm and Uppsala, which is some of the areas that we work in. And also, in one of the current projects that we are working in, we are also looking at actually mapping areas of disadvantage in terms of areas that have the highest prevalence of cardiometabolic conditions, for example, against the lowest socioeconomic status. So this map that you actually see here is from Crush COVID. It's one of the research projects that is focused on COVID. And it's just an example to show how postal codes have been mapped. This one actually shows vaccination uptake. But we're trying to do something similar in terms of cardiometabolic risk factors and looking at which are the postal codes that actually have the highest, prevalence, and it's connected to the lowest to the most disadvantaged. And working in the Swedish context, one of the things that those of you who work in this context will also realize is that socioeconomic disadvantage, especially in urban areas, is so tightly coupled with, for example, proportion of immigrants, that it's almost difficult to separate the two. It is so tightly connected together. We usually end up using one variable or the other. You can't actually use both. And also, depending on how the areas that we actually work with, depending on how you actually define immigrants, we are working with areas where you have maybe 30% and over of immigrant populations. And we are also looking at when you look at the neighborhood areas, one of the things is you don't look specifically at specific populations within that subgroup. So native populations who live in these areas, they are as disadvantaged in terms of living in vulnerable areas. And there is the concept of deprivation amplification, which is to look at how individual socioeconomic status actually is amplified also by neighborhood deprivation. And that is something that you actually see in areas, and that is one of the contributors to the poor health outcomes that we also see. So that has been one of the reasons why we tend to focus mainly on geographically defined areas. And another thing that we have also realized in some of the work that we have done in Stockholm is that identifying areas or identifying population groups is one thing, but reaching them is another thing altogether. So this is an example from one of the studies that we did in Stockholm, where we looked at the reach of community versus facility-based screening for type 2 diabetes. And what we realized is that we are reaching different populations. So in the facilities, you reach older and also more native-born European population, while in the communities, you actually reach more of the younger and the non-European population. And the population that we access through the communities, or we reach through the communities, are also the ones who will come to the health facilities only when they are really sick. So by the time they come to the health facility, we have lost that window of opportunity for prevention. So we need to actually think about strategies which are different from mainstream in order to access different segments of the population. And if we want to actually think about prevention in terms of leaving no one behind. And so if you think about neighborhoods as a unit of intervention, as we have done in several projects, and you look at literature, the association between health outcomes and neighborhood socioeconomic status is often pretty mixed. So in Netherlands, for example, this particular study that they have shown, they actually found that participants living in low socioeconomic status areas had a higher BMI than their peers, and this is related to the fast food outlets within 1 kilometer. And healthy food outlets did not buffer the potentially unhealthy impact of the fast food outlets. So this is this is a very recent study, but in general, there has been a lot of mixed results, and it is mainly also to do with how food environments have been defined in many of these studies, in terms of how the food environments have been measured and mapped in these studies. So that could also be one of the reasons why we often tend to see mixed results. Sorry. So in one of our studies that we have looked at again in Stockholm, which is done by one of my PhD students, what we have found is that food and vegetable prices in low or in socioeconomically disadvantaged areas is actually lower than the prices in the more affluent areas. And you also see the reverse when you look at the type of stores. For example, independent grocers and different type of ethnic stores, you actually see that they are more in the socioeconomically disadvantaged areas, and that is probably what mediates the lower prices. But what we are unclear of is whether this lowered prices actually reflects or leads to or translates to better affordability. We don't know that yet. Hopefully that's the next thing that we will actually look at. And when we work in communities, therefore food retailers become actually one of the key stakeholders. And qualitative studies that we have done with food retailers, for example, they talk about 3 things that motivates them or that drives them. So it's trends, it's demand, and it is laws or regulations. So for them, I mean, recommendations don't really help them because it puts a lot of pressure on them to do one thing or the other. And at the same time, trends and demands are not really driven by the most vulnerable groups. So we are kind of, again, in a dilemma there. And the other thing is, when you talk to the higher level in food retailers, they talk about corporate social responsibility and how it is actually important to look at health interventions. But that rarely trickles down to the local level, especially in the disadvantaged areas. You see a difference in the narrative when you go from the top to the bottom. And so we come back to this. So we're thinking about interventions, and we come back to this, the combination of population approach and high-risk approach. And there are literature which talks about what is actually missing in this, which is that maybe we need to think about addressing vulnerable and disadvantaged groups through a third but integrated approach within these 2 approaches that we are looking at, because that's missing. And we know that when we look at the data in terms of who actually benefits from a lot of the interventions and the policies that are prevalent. Now, I'm running out of time, so I'm going to talk a little bit more about engaging communities. And I think one of the things that we have struggled with, I've worked with a lot of different types of participatory approaches across different projects. And I think one of the things that we look at, it's important to engage communities, but how do we engage communities and how do we engage different types of stakeholders? So you can go from different types of approaches all the way from consultation to co-creation. And which method can you use where and with whom? And also, when do you need the overview? And to be very conscious of the fact that co-design fatigue is very, very real. And co-design is a buzzword now, so we talk about co-design all the time. But to think about what it actually means in terms of both the voice and the agency of the people who are being represented in the co-design groups. And then last, I would like to point to this, some of the unintended outcomes. For example, this study that we did in India, looking at changing household dietary behaviors, what we actually saw after 1 year of intervention using stage match strategies, community-based, was that fruit and vegetable procurement actually increased, but vegetable intake stayed the same, and or rather there was no change between intervention and control group. And one thing we actually saw was that gender was an independent predictor for for vegetable intake, and socioeconomic status was a mediator. So low middle-income households, we could see that males had better vegetable intake than actually females. And we can relate it back to the formative studies we have done, where we could see that women actually prioritize the needs of their spouses and their children. So that you can actually see reflected in the data. And I think one of the success things was also looking at locally available fruits and vegetables. So what we actually saw was, irrespective of the trend, like there was high inflation at that time and very steep rise in fruit and vegetable prices in the market. But in spite of that, the intervention groups were actually able to increase procurement, and that was solely related to actually the procurement of locally available fruits and vegetables, especially vegetables, and mainly vegetables which were like forgotten. Maybe, across generations, you kind of forget what we have used, forget because, some things take more time, some things take more effort, and you use certain knowledge across generations. So we actually focused on that as one of the strategies in the intervention, and households which were able to use those strategies, they were able to show an increase in fruit and vegetable procurement. So I will actually just conclude by giving you a few points of my reflections, and hope that you will actually add to this list when you're thinking about considerations for leaving no one behind. So maybe a common understanding of the concept, and also thinking about both the identifying and reaching populations, looking at neighborhoods as a potential unit of intervention, so place-based interventions that we see now, and addressing vulnerable groups separately and strategically, and also context, always throwing up very unexpected challenges. Thank you.
Thank you very much, Mina, for an excellent presentation. And yes, and Mina and Corinna will both join up here after I have introduced and we have listened to Ms. Antje Becker-Benton. Let's see if we get her up here. She is the Managing Director and Behavioral Change and Community Health at Save the Children. And she will join us digitally from Washington. So we will just see when she comes up here on Zoom, I hope. There she is. Hello, Antje. Good morning.
Morning.
Yeah.
How are you?
And morning for you, or actually I would call it night for you, but we pretend it's morning for you, and we're very glad you're here. So, before Antje starts, she and I would like to invite you all for a short check in the room. So I will ask you 3 questions, and you are asked to respond through your body movements. So the first question is, who has worked in development of food systems? And you stand up you answer by standing up. I assume everyone would stand up, no? If you're working in health, we include that, right? So, yeah, keep standing, please. Are you sure you're not worked in development of food systems? Okay. Then the next question is, who of you who are standing up then has been involved in social behavioral change work within food systems? And then you raise your arm if you are on this one. Great. And now, hang on, keep your arm up. This is the morning exercise as well. So those of you who didn't reply to the first question, you may stand up just to get a bit of movement. And who has been involved in social and behavioral change work in the Global South? And now, if you have done that, you jump. Great. And now you can also all wave behind you, because then I think Antje sees your faces a little bit. Yeah. So with that, thank you for engaging, and I will leave the floor and the screen to you, Antje.
Thank you very much, and good morning, everyone, and thanks for engaging in this exercise. It helps me to understand my audience a little better. As mentioned, I'm joining you from Washington, D.C., where it's still dark. And I'm happy to join your great session this morning. I will present about social and behavior change today, starting off with my latest trip to Karamoja in Uganda. You can see that on the map on the left side. I'll talk more about what social and behavior change is and about individual versus collective action, about refined approaches in nutrition, some learning from a multi-sectoral program in Cambodia, and then go into key takeaways and then look forward to your questions. As mentioned, I just came back from Uganda with a raging Ebola outbreak, actually. And what is interesting about it is that this time it's near Kampala. Uganda has quite a bit of experience with Ebola outbreaks, 7 times already, and effectively, worked on these outbreaks. But this time, people jumped out of their hospital beds and disappeared from the case controls because they thought it has to do with witchcraft. That is one of the reasons I called my presentation Culture Eats Slowly for Breakfast, because obviously people were less informed, have less trust in their health system, and just disappeared basically and tried to go to traditional doctors. So what is eating Karamoja here, a very remote area, rural area in Uganda, an underserved area, as the previous speaker mentioned. There are these areas in Uganda. And this is an area that is currently eaten for breakfast by a quite toxic combination of climate change, COVID, land grab, and traditional cultural raiding, which is now armed and is leading to violent conflict. And all of this on the backdrop of widely perpetuated bias against this population there. And I've been working on a food security project there for the last 5 years, and we have to admit that the food security situation, due to this toxic combination, is actually worse than when we started the project 5 years ago. So this as a backdrop, I think, for further discussions on social and behavior change, what can affect basically a project, large project, in an area that is affected by this combination of issues, which we will see also in other countries in the future. So what does SBC have to do with any of this? Social and behavior change is a discipline and has methods that can unravel a little bit, how people react to such situations, why they react that way, what their norms, values, and traditions are. And those are not always negative. They can also be assets for change, by the way. So social and behavior change is the systematic application of interactive processes and strategies based on theory and research to address social and behavior change at the individual, community, and societal levels. And you can see on the right side that it's grounded in social and behavioral sciences, but not enough with that. So it's not just behavioral sciences, it's also mass communication, it's marketing, it's design, and it's community development and advocacy. When dealing with social and behavior change, we're not only working at the individual level with nudges, which are very popular, I hear, in Europe at the moment, or behavioral insights, but we can also find out when that can backfire as a motivating strategy to address individuals only. In Karamoja, for example, we found through our qualitative formative research that Karamojong norms and tribal code are based on the belief that change is the effect of dialogue and collaboration as a community, not the achievement of an individual. So we were told the story of a woman who was given a goat because she has been such a role model in her community. And 2 days later, the goat was stolen and it was also eaten. And the community told us that we should not create envy and that success stories are never just due to one person. They could not have done it alone, and it's always a group that is responsible for such change. And so in Solution, we developed positive deviance stories on the radio through community reporters that we trained that found basically stories of community self-organization. And we worked with elders on the radio to debunk some of the myths that were part of of those stories, but highlighted basically how people self-organized without any projects and came up with community solutions as a group. I think this highlights why we are not just saying behavior change, but there is an S in front of the social and behavior change, and the S stands for social and structural. So social change is not simply the accumulation of changes at the individual level, it needs transformation of social norms and structures influencing such decisions. For example, to make certain health practices more acceptable, nutrition practices more acceptable, equip mothers and families with social resources and networks, bring communities together around common problems, and prompt also stakeholders through advocacy to support such action. So that's important to understand how we go about social and behavior change. Quick overview, how we have changed over time. You may remember the times when we talked about IEC, Information, Education, Communication, and that has changed over time to behavior change communication, social and behavior change communication, and in the 2000s we finally arrived at SBC to de-emphasize that communication is the only methodology we're using in this area of work. And then human-centered design and behavioral insights came to pass, which are integrated under the larger umbrella of social and behavior change. We have a large toolbox. Sometimes we even call it the tool shed. And you can see a variety of approaches here, including community engagement, advocacy, digital health. And now to SBC for nutrition. It's often using in our area of work, which is international work. I work for Save the Children, by the way, and often on large integrated programs. And these are in food security using often a set of outreach and small group activities in their SBC strategies. And what you're looking at here is when project coordinators work with trained volunteer promoters or paid community health workers, depending on the country, to address existing care groups, women groups, and saving groups in the community, to reach women of reproductive health, as well as their family members, to improve household level maternal, infant, and young child nutrition, addressing knowledge, attitudes, practices, and social norms to prevent stunting and wasting and promote optimal nutrition. The approaches that we're often looking at are here again. So it's starting off with training of community health workers in the areas of nutrition, but also adding on facilitation skills sometimes, or participatory methodologies, identifying and collaborating with care groups, sometimes also setting them up with mother leaders, also looking into women's groups and savings groups. What is often done are cooking demonstrations, also with the help sometimes of husband schools or male champions. Addressing savings groups to have a more comprehensive approach, promoting also community gardening, and often amplifying success stories through local and digital media. The newest recommendations from the USAID Advancing Nutrition Project, which is a global project that spearheads, among other things, also Nutrition SPC, shows and has broadened the set of audiences that can be addressed with SPC for comprehensive nutrition projects. So beyond the usual community leaders and the health workers, family members, and religious leaders, you're also looking at transporters, at retail market vendors, and at policymakers as audiences for social and behavior change. With some bullets underneath, detailing out what could be approached with them through social and behavior change. What is important and what is a bit of a challenge also in SPC is that not all behaviors are created equally. And in these large projects, it's often important to figure out, are we triggering new nutrition behaviors? Are we maintaining behaviors Or are we embracing the last 20% of a population that is not breastfeeding? Because that warrants different approaches, and triggering new behaviors is actually easier than the other two by far. Also, some behaviors are can be triggered by messaging or can be reminded of by messaging, but then there are some that are often habitual, and many of the nutrition and especially sanitation behaviors are habitual, which are not as reactive to messaging. And so the approach depends very much on the attributes of the behaviors that we're trying to change: habitual or planned, one-off or long-term, privately or in public, and so forth. So these are all things and categories that and basically checklists we're using to basically define and design our approaches. Now, not enough with that. That is the behavioral part, but agriculture components need to ensure availability of nutritious foods and encourage efficient use of income for nutrition. So it's not enough to have an SPC component. We need to either closely collaborate or have different components in these projects. Same with the care groups. They can increase demand for health services, but they cannot improve the quality and responsiveness of services, and so social accountability and quality improvement activities are needed. Care groups can also promote improved hygiene practices, but improved sanitation and community organizing are essential for improved water and sanitation behaviors in the community. And last but not least, and which is often a large barrier, women and girls can change norms on their own. Many of the barriers and motivators for positive change are external for mothers and for girls. Now, I told you I wanted to give some lessons learned from one of these more comprehensive programs. This is an example of such program. It was the Save the Children Let Nourish program in Cambodia, which ended 2 to 3 years ago. And Nourish targeted audiences, including rural families, local leaders, and business leaders through advocacy, media, and interpersonal communication, and a strong community engagement component. You see here the tagline "Grow Together," just to talk about what we also do, developing social and behavior change platforms and logos, and this logo is particularly interesting. Grow Together has a profound meaning in Khmer and can be interpreted in a personal way. It's a logo of a village with a rising sun behind and interlocking helping hands as fertile fields, which evokes feelings of the future. Everyone desires, where families and communities unite, and everyone plays their role for children to grow well. And the young rise, green, even the colors have a meaning. Golden and yellow colors signify growth and prosperity. To rural Cambodian families, this has been developed together with audiences and thoroughly tested, but you can see we're also having a strong marketing component here. So the project prioritized a couple of behaviors, and you see here with the first 1,000 days, families at its core, the campaign focused on the improved diet and antenatal care during pregnancy. For water, hygiene, and sanitation, the campaign promoted drinking clean water, construction of improved latrines, washing hands with soap at critical times, as well as separating animals from small children and properly disposing infant feces. For agriculture, the campaign focused on the promotion of water-saving microgardens, collecting nutritious foods around the house, as well as safe preservation and storage of small fish. And a very interesting part was that it was also included the development of small fish powder, including a cookbook and training courses on how to develop fish powder for better nutrition. And altogether, Nourish reduced stunting in children under 5 years by 19% and reduced women's underweight and anemia, supported by significant changes in key behaviors across key health, nutrition, wash, and agriculture. So an effective, large coordinated and a comprehensive program at that. There are also programs that focus only on one behavior, Alive and Thrive, for example, only on breastfeeding, which was also successful, but few programs have, I think, the luxury to focus on one behavior only. Hence my takeaways from this presentation, and I hope you have lots of questions. Social and behavior change goes beyond individual level programming and messaging. Nutrition SPC can be well combined within multi-sectoral interventions. Complexities stripped away when selecting only one focused behavior or one prototype or nudge, which is currently often done, tend to come back in when implementing at scale. So often it's very small projects that try that out in design, but once you basically implement at scale, all these complexities come swinging back at you. And then back to my initial story about Karamoja, issues of climate change and conflict around reducing and reduced resources require from us a combination of emergency development and resilience programming, including SPC, as a cross-cutting component, and that basically is important for food security and nutrition programs around the world. Thanks very much. I'm looking forward to your questions. And back to you, ladies.
Thank you very much, Antje. And now I'd like to welcome up also Mina and Corinna on stage, or the personalized food system, I'm going to call you now. No, we all are, right? From your presentation, we take that we are all actually the food system very clearly. So I'd like to start off giving the three of you the opportunity to ask each other questions. So maybe Corinna, if you have a question to Mina or Antje.
Yeah, I was fascinated by the approach that you were taking around dealing with communities which are, I never know the right word to use, but marginalised in various aspects. And I was curious about the process because the point was just made before that self-organising, and if things are imposed from the outside on communities, that there is a risk that you'll not understand the realities of those communities, in this case envy and obviously social dynamics and networks and norms that perhaps hadn't been considered in this gift of a goat. And you talked about how co-design fatigue and involving communities as if kind of we're going into communities and trying to get them to do things from the outside, and the kind of the risks to that. And I wonder about this a lot, and like how to manage that, even though we know perfectly well that unless we understand what's going on in people's realities, we're not going to get things to work.
Yeah, and I think, I mean, there are two things. One is the selection of the communities, which is, I mean, we, a lot of the intervention work we do, we actually work in identifying areas which are prioritized, say, for example, in terms of high cardiometabolic risk factors and low socioeconomic status. So you find that combination of areas. So that is one thing that we generally tend to work with in many of the projects that we work with. But I think in terms of, so one of the current projects that I'm working with, the next step is actually co-designing a community component. So there we have initially, for example, developed a telehealth coaching component to support with high risk, with prevention of high risk or reduction of high risk. But then when you want to actually set up a community component which is outside the healthcare, so there we actually engage community actors who will be part of this community, of the community outreach. So it's for us it's an approach where we actually try to link the community to the health system in a way, because you want to look at prevention, which is in a sense, it is the health system's goal to look at prevention, but often if you think about high-risk prevention, it has to take place outside the health system. So how do you actually facilitate that? And I think it's, I wouldn't necessarily say that we go top-down, rather I think there are, like for example, the selection is maybe done separately, but the community component will be co-designed. or so it depends on what stage, what is done where. And one of the things that I've experienced in the communities is everybody is talking about co-design, but we often mean different things, So how do you actually bring that together? And really co-design is a much more time and resource intensive process than is often done. So it's it's a balance between where and what do you focus on for each step of the journey. I think that's the struggle that we have looked at, we have had.
Thank you. Antje, do you have a question for Mina or Corinna?
Maybe just to add on the community component, I think in our experience it's quite important not to just create dialogue for co-creation, but to look at what existing and accountable community platforms there are in the countries. And in many of the developing countries around the primary care system, there are community facility committees. And I'd be interested to know, how that looks in Sweden. That there is linkage and there is accountability and participation of communities to give feedback to facility quality and to have inputs basically, so that whatever co-design is being developed also has a representative community structure to work with, and not just individuals that are picked by a project. I think that's something we've seen quite often. So my question is, how does that look in Sweden? Does it exist, and how do you work with communities?
Yeah, definitely it exists. And I think that's one of the things that we are doing now, for example, is really looking at mapping, and we're adding on to the information that we've already had in terms of, looking at the areas that we are working in and identifying different types of community actors who will be part of the process. So the initial part, and this also links, for example, to the local administration. So that is the part where we are now spending a lot of time before actually a lot of the project or the research activities actually begin, because the project may be financed for 3 years or 4 years, but the goal is to see that we actually build relationships which can actually go beyond. So hence the work through Uppsala University to actually leverage on like collaboration partnerships that they actually have with municipalities, and also to engage communities so that we form a loop that can go beyond those 3 or 4 years, that we are originally financed for. So yes, the short answer, they definitely do exist, and it takes time to actually engage and work with different partners, and also to identify different types of solutions to the problems that we are actually working with. So that's going to be a long-term process.
Great, thank you. And Mina, do you have a question or reflection to Corinna or Antje?
Yeah, I actually have a question, not a question, rather a reflection to Antje. The story of the lady whose goat got stolen, and about, don't create envy and isolation. So, interestingly, one of the things that we experienced when we did the household behavior change intervention in India was, and there also we worked like in villages, and it was the whole villages who were engaged. So in the exploratory studies, one of the things that household participants told us was, well, if we are part of this intervention looking at changing, household behaviors for diet, you're doing things differently from your neighbors, we're going to be strange. So you don't want to be strange. So it's not just the envy, but it is also maybe the isolation or the feeling that you don't want to be different, you want to be part of the community. So actually what most of the projects we work with, even though we end up measuring specific individuals in specific households, we still work collectively in the community. So communities engage in different ways. For example, if you're looking at awareness sessions or different aspects, it's the communities and families that come together for it. Maybe as part of the research, you measure only some of them, but it gives a legitimacy to the people who are actually also working, the households who are actually already working actively in the intervention, because you see that it's part of a wider change or a wider newer norm that's coming in the community, that it's fine, it's a new trend maybe to work to eat healthy and to look at, to consider your health in a different way. So I think I actually related quite a lot to what you talked about there.
Yeah, thanks. And that's basically an important area of work where we're addressing social and cultural norms and gender norms quite a bit. There's a lot more of instrumentarium these days, how to identify social and gender norms, how to approach norm change, and also how to work on agency. And when it comes to being strange from the rest of the community, one of the strategies we're using is to generate social support from community leaders on platforms, and also to work with different generations. Often the change comes from the younger generation, and where they differ from the older generation, this is where the behavior change happens and the social change. Thank you. So just a heads up, I will very soon invite questions from the audience. First, I'd like to ask you, Corinna, so this summit is of course linked to the UN Food Systems Summit that was a little bit more than a year ago. So are the voices heard that you think should be heard? And linking it to your excellent food system analogy, like how far has the food system gone in its treatment and visits to the doctor? Are we?
Well, the question of whether the voices that need to be heard are being heard, the UN Food Systems Summit was an interesting observation. It was interesting to observe from that perspective. I don't know how many people are even familiar with the UN Food Systems Summit, but it was a process of bringing lots and lots of people together to have a conversation and to identify actions and to stimulate action on food systems. So yeah, lots of ways lots of visits to the doctor, as it were. And lots of people were involved, and the leadership of the summit involved. They brought together people in governments, people in business, people in civil society, people in NGOs, farmers groups, all of these different groups. And yet, from people who were less involved with the summit, were very critical of the summit because they said, you're not being inclusive, you're not including people's voices, you're not listening to the voices, you're not enabling people to participate, and it's dominated by food corporations. And those of us who were working inside of the summit structure, it felt like an odd criticism because that wasn't our experience at all. That was the case. Lots of people were around the table. It wasn't dominated by interests that were drowning out other voices. But what was very absent from the UN Food Systems Summit process was the managing of power relations. So certain voices were listened to more than others. Certain voices were invited to participate, but when you're one person working in a back room somewhere with no capacity, no resources, working for a civil society or farmers' organisation, you don't have the resources of the big corporates who've got millions of people working in these areas. So it didn't take into account the reality of different power between all of these different voices. And it should have done. It was something, I think, reflecting on it, that was a mistake. And I think this is what so irritated and upset people who were on the outside. There was diagnosis, there was something was wrong. It was just that what they diagnosed wasn't quite right, to continue with the doctor analogy. So I think it's just the lesson for me was be inclusive, invite participation, but make sure that you acknowledge the fact that those players have different power and manage that.
Interesting. Thank you. Now, any questions from the audience to either of our speakers? And please state your name as well.
Thank you. My name is Maria Magnusson, and I work at a public health unit which is connected to a hospital in west of Sweden. I want to thank you very much for very interesting presentations, and I would like to add to what Mina said about the situation in Sweden, because our unit is unique, I'm quite sure, at least in Sweden, because we are connected to a specialist hospital, but we have a commission to work to promote health in the surrounding areas, which consist of people mostly, well, they are underserved areas, as you described. We have, also I want to underline what you said about it takes a long time. Because I work with research too, and with participatory research, and we we don't call it co-design, but it's what we try to achieve. And when we have been in the area for a long time and we build networks, and then we can have the questions and issues from the communities as starting points. And then they have their own drivers to participate in the way they can. And that takes trust building. It takes that they know that we will be there, or some of us will be there and support them, and we will not just come in and get out. So I think that's sort of, and of course we work with stakeholders like health communicators and cultural interpreters and people who have trust in the local community. So I think that's a way forward, which I'm sure you agree on, because these short financing, I mean, 3 years is quite a long time in the research world, but it's a short time in the people's reality. So I just wanted to add to say how we work. Thank you.
Thank you very much. Anyone else? I see a hand far in the back at least.
Hello, Heather Mackay, Department of Geography, University of Lund University. It's not actually a question, I just wanted to throw this out there as a recent news event that happened. I live in the north of Sweden, in Västerbotten, and just a few days ago, it was a very pertinent example of how even in Sweden we don't always do this very well, or we have these problems with behavioural change. So there was a local news article on TV where Lycksele in the inland had tried to change the school food program to be more healthy, more sustainable, more environmental, in line with all these guidelines. And there was absolute rage and outrage and anger and aggression directed at the kitchen staff and this poor chef who tried to implement these changes. It was secondary school children, maybe 16 years old. They hated it, they were really negative, they didn't like it, but it was the parents who started calling in. There was threat, there was anger, there was aggression, they had to remove it all. It was an absolutely horrifying news story, and it's created a lot of debate in Västerbotten right now. And I don't know if anyone has any comments on that or has heard about it, or if you would have some advice there, but it's an example of this change not going well.
Thank you. Yes, any comments?
Yeah, I mean, sorry.
No, go ahead.
I'm really appreciative of that, and it's not the first time that has happened. No. But also there has been successful stories of change, of school food and beyond. And it was hearing stories like that that led me to focus much more on understanding people's lived experiences and lived realities. So for that, you'd need to involve the children, you'd need to involve the kitchen staff, you'd need to involve the parents in making that change. Because if you don't understand people's perspective, status around food, identity around food, meaning around food, all of those critical issues you're missing, and you just think you're coming in and you're doing this wonderful thing, aren't I so wonderful with my halo on my head, helping people eat more nutritious food or sustainable food. And that's not how people receive it necessarily. It varies enormously with context, of course. But it's why I have a mantra, it's not just what you do, it's how you do it. And taking into account and really understanding how people, the meanings that people have around food is one of the reasons why we are not changing fast enough, which is why I presented that, what I call the full picture of people's realities that you need to engage with and understand when you are designing and actions and identifying what to do. So in that case, you would have had to have gone in and done that engagement and participation to understand issues about meaning and trust in that particular community.
Yep. Thank you. Any other? Here's one over here and one in the front. You can start here in the front, and then you can, because it's, go where you want. Sorry. It's Dr. Branca.
Yeah, thank you. Francesco Branca, WHO. So I'd like to ask Corinna a question, particularly around the role of investors. There are some funds that have developed certain criteria for investment, but they are very narrow criteria. And if you speak to this investment fund, they say, but actually there is very little companies that qualify, so actually the flow of investment there is minimal. So the challenge is to really identify some of the objectives, which is basically asked to the companies or what they should be doing so that this investment fund can be channeled. So that's the first consideration. I'd like to ask your thoughts about that. The second one is, I remember your analysis on the supply chain of palm oil, where actually you highlighted the very important role of public investment, whether it's infrastructure, research, also trade facilitation. So I don't know whether I missed that, but in your framework, what is the role of the public investment in food system, and where do you think that would make a big change? I mean, one of the big drivers, for example, of the current situation of the food system was a public investment done in the US on, for example, maize subsidies. And at the moment, actually, the subsidies are probably one of the greatest drivers. So shouldn't we start from there? That's the heart.
Yeah.
Great, thanks.
Sorry, I'll wait.
Yeah, please.
I'll go, yeah. Okay.
Thanks,
Francesco. So I was showing some examples there, absolutely not exhaustive in terms of what is needed to make the wheels of the economy work differently and to move towards it. So I highlighted one aspect of investors. And there are now groups of investors worth trillions who are engaged in this process through the Access to Nutrition Index process and other processes that are involved. But you're right that what they lack is what are the criteria through which we will say we will not invest in that company, or we will from a nutrition perspective. Sustainability is getting there, but from a nutrition and healthy diets perspective, it's not there so much, and it needs to be. But there are, the World Benchmarking Alliance and there's another group as well, are trying to push this forward. But the other important part of that is that corporate governance requires corporations to pay shareholders when they achieve profit based on their quarterly earnings. If the corporate governance law was changed to say we will not, our shareholder value will be measured according to how many people we make healthy, and there's a movement towards doing that in other areas called the Profit with Purpose movement, that would really change the metrics, but they need the investors to kind of force that on them to say, these are the metrics that we want you to use in order to measure that. So you need both corporate governance and investors to change. And the answer to the second part of your question, public investment is incredibly important. Trillions of dollars every year is spent in the food system. And the priority needs to be in spending that money differently, whether it's private investment or public investment. And there's so much that you could do. There's all of these calls for, we need more money. Well, why not spend the trillions you're already spending differently? So again, I completely agree. The challenges, of course, and this is why I highlighted managing power relations and managing conflict in my remarks, is just the political economy is very, very complex. Around shifting who gets what resources. It's a real, a lot of conflict there that needs to be worked through, which is why you need strong leadership to work your way through that.
Thank you. And another question down here.
My name is Gloria Jimaga. I work with Africa Gruppena here in Sweden, policy advisor for food and land rights. I have a comment and a question. So I'll begin with a comment to Corinna. I think it was really interesting what you highlighted about the food summit and the power relations. And the thing is that we also see the same kind of denominator when it comes to the COP27. You have also stakeholders and NGOs complaining, and which is justified in terms of inclusion. And this is more vivid in terms of that this is not really integrated when it comes to solution and decision making, how much power relation and how much monetary values have a very big decision making in the process. And also that we cannot deny when it comes to the solutions, there is also money put in place, and there is different institutions that are given the power to implement these solutions. And these solutions sometimes do not take into account the context, and mostly has a very Western perspective. And I think that is something that we do not discuss enough in forums as today. Like, what kind of perspectives and ideology are we more imposing what we believe the world should look like, or what is the reality? And a question, when it comes to Save the Children, you talked about behavioral change. I'm really interested to ask you, what kind of a behavioral change does Save the Children see and want to see? And is this the behavioral change that communities in Uganda want to see? And also, how do you ensure, again, with a perspective and ideology, and this is a power relation, on what kind of behavior is right? And how do you ensure that this agency is really acquired? Because it was really interesting with your story on the goats, and what kind of context and norms of celebration was considered, because you can give a prize, but it's not actually into that context. So I really wanted to get that insight from you. Thank you.
Thank you. Yes, Antje, please.
Yeah, these are very good questions and on the mark with regard to behavior change. And I think at Save the Children, we have both approaches. You know, often the public health approach, which applies often to things like COVID or Ebola, looks at behaviors first and at people second. And that's a bit of, you know, it's trying to control diseases, for example, and it's coming in with a clear understanding of what needs to happen to curb something like that worldwide. Whereas development, social and behavior change approach looks at people first and then at the behaviors, and also identifies priorities of communities when coming in with these projects. And at Save the Children, we happen to have a strong approach that emphasizes community engagement. And also respectful entry into communities, community visioning, and reviewing what acceptance there is of behaviors that projects suggest, for example, from the outside. That is not always done in all projects we're working in, but it happens to be the approach that we favor in my team. I have a team of 15 people in Save the Children US. But often enough, I've seen projects where, you know, like this GOAT project, you know, where people come in and want to do good and give out the goats without having, as you mentioned, reviewed what it means if you receive a present as an individual and how that can be more community-based, which should have been researched beforehand, so no doubt about it. So, you know, as an organization, what social and behavior change do we want to see? I think our emphasis is on children, it is on education, health, and protection. But again, usually with a stronger community emphasis than I've seen in other projects. And with, I think, fairly tested and advanced methodologies of community action cycles, that then work with community platforms, which are representative of community members also, on, you know, what advances communities want to see for themselves. Data for decision making is part of it, yeah, I think that I hope that answers your question. So, you know, what you see in development is a big mix. There's still a lot of top-down approaches, but it's slowly changing. But then, as one of my colleagues here mentioned, often what is underestimated is the cost and the time it takes to actually involve communities in that way, but it definitely achieves more sustainable goals. Over.
Thank you very much. And that will be the final words of this discussion. So thank you, Antje, thank you, Corinna, thank you, Mina, very much. And good night, good morning again. Thanks. Okay, we will very, very soon have a break. I will just give you the directions for the workshops that starts at 11:20. So today we have 4 workshops. We have food safety versus food security, and you are in the galleriet. Now you find your way, the lunchroom. And we have foodscapes for the future. You're down in Vasasalen, which is below here. You go into that door, and there's stairways down. We have a global health perspective on the future of meat, and you are in Johan III. That's that room over there. And then we have tackling microbial resistance for sustainable food systems, and you are here in Rikssalen. And I will also just announce that today we are honored to have Dr. Matshidiso Moeti, who is the WHO Regional Director for Africa at the summit. I think she's have arrived or is arriving. So please welcome her and her colleagues that they might join the workshops. And we will meet back here at 3:45, but it looks like someone wants to say something. Okay, so the foodscapes, foodscapes for the future, you start 11:10 in Vasasalen. So go and grab a coffee and get ready. Okay, thank you.